Well, it's time now for Health Report, and joining us now is Africa 54 health correspondent Linord Moudou. Hello, Linord.
Hello, Vincent. The World Health Organization says new human diseases should be given socially acceptable names which do not offend people and countries or mention animals. The WHO says a Middle East respiratory syndrome and Spanish flu are examples of what to avoid because they mention specific locations. Instead, names should contain generic terms that are easy to pronounce. The international organization says several new human infectious diseases had emerged in recent years, and some had stigmatized certain cultures, regions, and economies. The WHO has produced advice for scientists and the media. Experts warn antibiotics-resistant typhoid is spreading across Africa and Asia and poses a major global health threat. Researchers from the Wellcome Trust have been tracking the hard-to-treat infection. They analyzed bacterial samples from 63 countries. Nearly half of them were impervious to standard antibiotic treatments. They say over-reliance on these drugs is to blame. The countries, mostly in Asia and Africa, where typhoid is endemic, had a multi-drug resistant strain of typhoid called H58. Researchers say it is replacing regular typhoid that have been around for centuries. Increasingly, doctors now need to use other, more expensive and less readily available antibiotics to treat typhoid fever, a disease that kills around 200,000 people each year. The research was published in the journal Nature Genetics. A new research conducted by the University College London says regular blood tests can detect 80% of ovarian cancers before the point at which a woman normally would be diagnosed. Ovarian tumors are often deadly as they are caught too late. The cancer is difficult to pick up as symptoms, including abdominal pain, persistent bloating, and difficulty eating, are common in other conditions. Ovarian tumors spew out high levels of a chemical called CA125, which is already used as a test if patients have symptoms. The researchers performed annual blood tests on postmenopausal women and tracked changes in the levels of CA125 over time. The first results of the 14-year trial of more than 46,000 women suggest tumors can be detected early. Now, child mortality has dropped in Uganda's capital city. Observers say it is partly due to Kampala's free maternal health care and better equipped health centers. Inside Uganda's second busiest hospital, mothers rest in the maternity ward as they admire their newborns. The international non-governmental organization Save the Children says child death in Kampala dropped faster than in any other African city between 2006 and 2011, despite a large influx of refugees from war-torn neighboring states. Esther Kabumo, a refugee from Congo, came to the Kisenyi Health Center in Kampala to have her baby. She is recuperating after a cesarean section delivery.
We're happy because they welcome everyone without discrimination. They treat everyone the same. If you don't have money to buy medicine, they take care of you. There is no problem here. That is why we're happy to come here.
The UN Children's Agency, UNICEF, says Uganda cut child mortality by 4.3% a year between 1990 and 2013, just below the 4.4% annual reduction needed to achieve a Millennium Development Goal on lowering the number of deaths of children under 5.
The solutions that we're talking about, if we want to reduce maternal and child mortality, are really basic and within our reach. Take an example, we expect a mother to be able to be informed and sensitized to go for antenatal care and during pregnancy for at least a minimum of 4 times. And that is, if the mother comes to the facility, we expect the mother to be able to access basic medicines for malaria during pregnancy, to get immunizations for tetanus, to be able to be examined and also have the reassurance and motivation to come and deliver in the facility at the time of birth.
Kisenyi Hospital delivers 600 babies a month. The facility symbolizes the shift in Uganda, which has seen the country invest more money in the healthcare system to make it accessible for the poor. Healthcare has been free in Uganda since 2001.
With all the services we offer here, automated lab with all the powerful machines we have, the theater, the neonatal, the scan, circumcision theatre, all the sections you visited here are basically free of charge.
Government outreach efforts that encourage people to seek health services via churches, mosques, the radio and door-to-door visits by health workers have also supported Uganda's success.
We normally encourage mothers to deliver in the hospitals, safe places, let them go and attend antenatal clinics so that they get to know what is going on. Even we encourage their partners, their husbands to escort them.
Save the Children says under 5 mortality among Uganda's urban poor fell by 29% between 1995 and 2006. And that's our Africa Health Report for today. Back to you, Vincent.
Well, Linord, thanks. Now be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.